Hi, I'm Shivagani. Thanks for checking out the Raised Line interview series, in which me and my co-hosts, Dr. Rishi Desai and registered nurse Jana Emil, explore how to strengthen our healthcare system with some amazing leaders in medicine, technology, education, and government. And they have some great advice for people starting careers in healthcare as well. I hope you will watch these highlights and then go listen to the full podcast interview wherever you get your podcasts.
Hi, I'm Dr. Rishi Desai, and today on Raise the Line, I'm happy to be joined by Dr. Garth Graham, Director and Global Head of Healthcare and Public Health at Google YouTube. A cardiologist, researcher, and public health expert, Garth is well positioned to help discuss where we stand today with COVID-19. So Garth, do you mind just starting out by telling us a little bit about yourself and what led you to your interest in medicine in the first place?
Professionally, I'm a cardiologist by training. And I did my med school at Yale and my cardiology at Johns Hopkins, and have gone through a variety of different roles in the healthcare industry. I spent a decent amount of time in the federal government, where I was a deputy assistant secretary in both the Bush and Obama administrations. And then went back into academics, where I was chief of health services research in the Department of Medicine at the University of Florida. On a personal level, I always like to throw that in because I think for most of us, our careers aren't defined by just what we've done at work. We bring so much to the table in that equation. So I was born in Jamaica and raised partially in Miami and partially in Jamaica. So I have a kind of a mixture of that Caribbean American heritage.
You know, we have a lot of students and early career health professionals in our audience. What's your advice to them about meeting the challenges of this moment and approaching their career in healthcare?
You know, my advice for students is follow your passions and that passion that has kind of carried you this far. I don't know where along the line, Rishi, we as we've trained students, we sometimes have them focus on their anatomy, pharmacology, and their physiology without continuing to stoke a lot of those things that brought them to health and public health in the first place. That passion for changing individual lives, that passion for not just the heart, but the actual patient that goes along with the heart. That passion that brought you here, stick with it, because that's a passion you're going to need on the other end when you get out of training to deal with these major public health and healthcare challenges that we're facing. And I would say that, at the point, hopefully there will be a point where COVID is entirely in our rearview mirror, unclear when that's going to be, given all the global dynamics that we're seeing now. But at the point when COVID is in our rearview mirror, there'll be other problems that are in that front view mirror as well. And that same passion that you're going to need that drove us through COVID, we're going to need that to deal with the other challenges on the road.
Thanks for watching this preview of Raised Line. To hear the full interview, check out all of our podcasts and subscribe to the series. Please go to osmosis.org/Raised Line podcast or listen wherever you get your podcasts.